जाता है कि दमा दम के साथ जाता है। तो उसी अस्थमा डे के दिन हम अवेयरनेस क्रिएट करने के लिए यूट्यूब के दर्शकों को कुछ सावधानियां बरतने के लिए, समझने के लिए, समझाने के लिए हम अस्थमा दिन के दिन ये वेबिनार आयोजित कर रहे हैं। इंडिपेंडेंट रिसर्च एथिक्स सोसाइटी की आयुष समृद्धि इंटरनेशनल वेबिनार सीरीज के 2366वें पड़ाव पर आप सभी का हार्दिक स्वागत। आज टॉपिक अस्थमा केयर बाय आयुष। हमारे साथ आज एक नए वक्ता डॉक्टर रिगोम पेगू जी। वेलकम वेलकम। मेडिकल ऑफिसर आयुष, आयुर्वेदिक डिस्पेंसरी जोनाई, गवर्नमेंट ऑफ Assam. It is in Dhemaji district. So from Assam, welcome Dr. Rigom. I would like to communicate my best regards to Dr. Vishnu Prasad Sharma ji, pillar of Ayush Samriddhi. He is the pillar of Ayush Samriddhi and supporting us right from the beginning of Ayush Samriddhi. I am really grateful to him. बहुत बहुत आभार सर आपका। और मैं विष्णु प्रसाद शर्मा सर से प्रार्थना करता हूं कि वो हमें उद्घाटन आशीर्वाद और स्वागत भाषण दोनों दें। वो काय चिकित्सा के हेड रहे हैं, तो अस्थमा के ऊपर भी वो एक्सपर्ट हैं, अभी तक चिकित्सा करते हैं। मैं आदरणीय विष्णु प्रसाद शर्मा जी को सादर आमंत्रित करता हूं। आई वुड लाइक टू वेलकम डॉक्टर विष्णु प्रसाद शर्मा सर। वेलकम सर।
Namaskar. Good evening to everybody. Hari Om. Respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this AYUSH SAMRIDDHI International Webinar Series on Asthma Care by AYUSH. Most important subject today we have. In this webinar, we have eminent speaker. I want to welcome Dr. Rigom Pegu, Medical Officer AYUSH. Namaskar, Rigom. Ayurvedic Dispensary Zonai, Government of Assam, Dhemaji. He did PhD, he did MD under my guidance. He did PhD under my guidance on bronchial asthma. He did silico approach study also. And he developed a very good medicine for bronchial asthma. So welcome Dr. Rigom Pegu to this AYUSH Samriddhi webinar. Next, I want to welcome Dr. Nishant Shukla from Jamnagar. Namaskar, sir, and welcome you to this AYUSH Samriddhi webinar. Next, I want to welcome Dr. Suparna S. Mukherjee from Bolpur. Namaskar, madam, and welcome you to this AYUSH Samriddhi webinar. आपको स्वागत करते हूं। Next, I want to welcome Mr. Sanatan Mahakut, renowned poet, yoga, and wellness expert from Kolkata. Namaskar, sir, and welcome you to this AYUSH Samriddhi webinar. Once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this AYUSH Samriddhi webinar on important subject, asthma care by AYUSH. सबको स्वागत करते हूँ। नमस्कार और बात पवन जी।
Thank you, sir. Thank you very much. Now I would like to call Rigom Pegu ji, our first speaker of the day. Rigom ji, welcome.
Thank you so much. Firstly, I would like to take this opportunity to thank my guru, Professor Dr. Vishnu Prasad Sharma sir, for whom I am today here. And I would also like to thank Dr. Pawan Kumar Sharma sir, convener and host of AYUSH Samriddhi Independent Research Ethics Society. And I feel myself very proud to be one among all those speakers who speak on World Asthma Day. And actually, I'm a very new person who speak this webinar series.
You can
So,
share your slides if you want.
firstly, I would like to speak on my topic on stomach sores, bronchial asthma in Ayurveda and in silico approach. Myself, Dr. Rigam Pegu. Actually, asthma, the World Health Organization recognized asthma as a disease of major health importance and declared the first Tuesday of May of every year as World Asthma Day. The most recent revised global estimation of asthma suggests as many as 334 million people have asthma. The burden of asthma, India has an estimation of 35 million asthmatics and accounting 12.9% of global asthma cases, 42.4% of global asthma death. Economical burden of asthma in India, cost of asthma treatment 34.3 millions and 9% of per capita annual income. So asthma is the 14th most important disease in the world. No common definition regarding asthma pathology is being understood. So, still yet, JINA 2015 has defined asthma as an heterogeneous disease. It is characterized by chronic airway inflammation. It is defined by the history of respiratory symptoms such as wheeze, shortness of breath, chest tightness, cough that varies over time and in intensity, together with variable expiratory airflow limitations. So today, what is the challenge in asthma care is diagnosis. As I'm being surveying as a medical officer because of the lack of institutional facility, we are not being able to diagnose some regarding respiratory illness. And this is also one of the factors. And under treatment, patient who is undergoing treatment because of the lack of awareness, they lag behind the treatment. And social stigma, this is also one of the big cause, avoidance of treatment because of lack of education and environmental factors, air pollution, environmental, etc. are some of the environmental factors. And what is the key objective is how can we come across all these challenges in asthma care. My little opinion it is to raise awareness and empower educational events on asthma knowledge, management, and medical health. Improve, assist, advocate effective medicine and healthcare for asthma. Government initiative and awareness. There are lots of policies, but uh, management and reducing stigma with better implementation practice is, I think so, yet to be implemented and emphasized more. And lastly, working together towards a solution. It's including of diet regime, lifestyle modification, quite which is quite important. You and encouraging more research work on asthma. So there are some types that are being mentioned which help us to diagnose regarding the asthma based on the symptoms, airflow limitations, and lung function. This especially this category of types of asthma help us to diagnose.
Do you have any presentation, doctor?
हाँ सर.
आपका कोई प्रेजेंटेशन है तो शेयर कर दीजिए. टोटल टाइम 20 मिनट्स है पर लेक्चर. If you have presentation, please present it.
Findings, sir, regarding my findings, sir. Actually, we did some clinical trial on polyherbal formulation.
You can share your presentation on screen.
Sir, actually, being new to this social media, so it's very tough for me, sir. sir.
Okay. No
Sir.
problem.
I want to.
Presentation to আছে নেকি তোমাৰ তাতে?
Sir, I have the presentation. I have mailed it.
তুমি
I
শ্বেয়াৰ
have
কৰিব
mailed it.
পাৰে?
Sir, I have mailed it. I have mailed it already, sir. Sir, I
अच्छा
have mailed
पवन
it.
जी आपका पास भेजे हैं, आप ही शेयर कर दीजिए।
ऑन मेल?
Yes, sir.
ये पहले बोल देते तो कृपा होती ना दोस्त। Just a sec. Just a sec. Please give me 1 minute. टोटल टाइम इज 20 मिनट्स प्लीज। आप फटाफट फास्ट चलिएगा, आपकी 87 स्लाइड हैं जी, प्लीज।
Slide number 5, sir.
स्लाइड नंबर
5, sir.
1 2 3 4 5 टाइप्स। स्लाइड विजिबल हैं?
Sir,
दिस वन?
sir. Yes, sir. Actually, this is the types how we try to clinically evaluate mild intermittent asthma and mild persistent asthma and moderate persistent asthma and severe persistent asthma. I will not go in details. So, little bit I want to review and a review of the literature. I want to give review of the literature where Susrita has mentioned. Sir, next lecture. Introduction. विहाय प्रकुपितम वायु प्राण अथ कफ सहित श्वास अथ ऊर्ध्व होते श्वास परीक्षित. Very beautifully, Susruta has explained where the vitiation of Vata associated with kapha obstruct the prana vahak sotas, lead to the excitement of Vata, produce upward movement, causes breathlessness. Madhav Vedan also has explained regarding Bastrika Dhamani, that is noisy and rapid respiration. The next slide, sir. Actually, there are 5 types of Swasrok as mentioned: Maha, Urdha, Chinna, Tamak, and Chudra. Some of the Nidanas, sir. Next, sir. Some of the Nidanas that is being explained by Charak, Bhata Prakopa, Bhar, Rukshanna, Sita, Shivanam, Apatarpanam, Vishamasanam, Adhyasanam, Samashanam, Raja, Dhum, and lots being mentioned. Next is regarding the Papa Prakopa Viharas, like the Sita Sthana, Sita Pan, Sita Bayu, Avishendi Upachar, and Abhyakta Karana also, and Bahya Karanas. And various other diseases that also is causing Swasroga, Atisar, Jwar, Chardi, Pratichaya. Sir, next slide, sir. Yes, sir. Next, sir. No, sir. Next, sir. Next slide, sir. Next slide. Sir, Samprapti, it's been very beautifully explained by Charak. Eras Rothamsi Sandurudhaya Marudha Kapa Purvakam Vishaka Bhadrati Sandurudhaya Swasa Anna Karoticha. And this has been very beautifully explained how the propagated by adherence of in the Urushthan and observe the pranavaya protas produce. We have 5 different types of swasrok. Sir, next slide, sir. Next, sir. Next, please, sir. Next, sir. Next, please, sir. Hello. Next, sir. Listen. Next, sir. Type of tamak swas. Everybody know that pratamak and santama. There are 2 types of swasrok. When Jwara and Murcha, when Tamak is associated with Jwara and Murcha, this condition is the Tamak Swas, marked with Udavarta, Raja, inhalation of dust and clean old eats, fire, nirodha, suppression of natural urges, aggression in the tama, that is at night time, and get elevated instantaneously by cooling regime. When it is being, when tamaka or darkness comes in front of the eyes, then it is considered to be as the Santamokswas. And regarding Sadhya Sadhyata, Mahaswas, Urdha, and China are considered as Asadhya by Susruta. And Sadhya in Mahaswas, Sadhya only in Abhyakta stage, Urdha Swasa, Sadhya only in Abhyakta stage, and China Swasa, Sadhya in Abhyakta stage. Tamak Swasa is considered Sadhya in Abhyakta stage, Yapya Vacharak, and it's a Sadhya by Susruta, Asadhya in Durbalya patient by Susruta, and Shudra Swas is considered as Saita. Now, there are lots of Chikitsa Siddham that is mentioned by our treatises like Nidan Parivardan and by Charak to avoid the causative factors. And according to Charak, a good will person or Balawan and those having the predominant of Kapha can be treated with southern therapy like Baman Diricha, and thin will person like Durbala and having the predominance of Pata, it always managed with the Samsaman or palliative treatment. Tehan and Sweden also have been mentioned very beautifully and being described with well mixed with salt, followed by the suggestion by Nadi sweat, Prastara sweat, and Sankara sweat. Baman and Birichan has also been very beautifully been mentioned by Ashtanga Hide, Ashtanga Sangraha. Swas uh, occurs from aggravation of pranavata, and there is benefit to prescribe Sodana in upward direction, that is Baman. And Swasarok caused by the hindrance to its movement by obstructing from Kapha, then it is benefit to prescribe Sodana in downward direction, that is the Dirichana. Then Ayurveda has also mentioned the use of Dhumrapan and the Nasya. And there are some 10 single herbs which is mentioned as Swasara Mahakasai, Sati, Puskarmul, Amlavetas, Proti, Nasehin, Tulsi, Agru, Goyamlaki, Juvanti, and Chanda. There are other herbs that are also being mentioned in our treatises, which is used in Swasro. Some of them are Hingu, Siri, Destimodo, Arka, Pipali, Bilva, Guduchi, Sunti, Haritaki, Haridra, so on. So there are also the formulation that is mentioned in Ayurveda regarding Asava and Arishta, like Pantha, Tanaga Asa, Draksha Arishta, Draksha Asa, Kuat, Dasamula Kuat, and there are lots other Churna, Talisadi, Churna, Sitapaladi, Avaleha, like Kanthakari Avaleha, Draksha Avaleha, Grita, Dasamula, Adi. So many formulations are mentioned in Ayurveda. And Taylor regarding to Taylor is Chandana Adi Taylor, Gudichi Adi Taylor, Bati, Ella Adi Bati, Dalis Adi Bati, Views Adi Bati, and so the are also being mentioned, like Swas Chintamani, Swas Piparas, Ananta Bhairavaras, and so on. Pathya and Apatya are also been very beautifully mentioned by Charaka. Draft food articles and drinks that are which are Kapha Apna and Pata Ushna and Bata Anulomana are benefit for patient of Swastok and Apatya these months should be avoided. Right, and oily substances, master, Sarpi and Duda maintenance of the it should be avoided, Macha and Dusti, Delasevana should be avoided. Then there are some herbs used in asthma with like series Kandhakari with all those Ayurvedic with Ayurvedic properties as well as the pharmacological activities with anti-asthmatic as well as anti-allergen, fungal, bacterial. Also, the study has been already taken out. As a glimpse, I would like to bring the herbs, single herbs that are commonly used for asthma, like Destimodium, Glycoroida, Glabra, Pasa, Patatada Basica, and Tulsi Osimum Santam. So now I would like to bring highlight regarding my clinical, our clinical study on regarding clinical efficacy of polyherbal formulation in the management of stomach swas. And on the other hand, we have studied regarding the scientific study regarding the study of Basak, Adatada Basika, as well as the Kanthakadi and Justimadu. There are two studies. One is the clinical studies and other is on molecular doping study. There are 3 plants that we study: Adapada, Vasika, Kanthakari, and Justimodu. I would like to bring the aim and objective regarding clinical study. This was to study the efficacy of polyherbal formulation in the management of stomach sores. And there were some, the objective. Basically, in this polyherbal formulation, we use series, Alvezian levate, Bent, Kanthakari, Solanum, Dentocarpum, Destimodu, Glycorogia, Gleba, Basak, Adapoda, Vasika, Tulsi, Osimum, Centum, in the form of coarse powder, and was prepared in quart decoction form. And duration of treatment was of 3 months, followed by 1 month interval. And they were analyzed by using the statistical analysis. So these were the selection of the patient: Pratigam, Pranavayu, Kasa, Gurgud, Havami, Tamak, Anupashana, Parsa, Vadraha, Repetition, Sabatu, Anidra, and Sankabhet. Now I would like to, there are some inclusive, exclusive criteria investigation allocation from the government Ayurvedic college, IPD and OPD patients, Jalpari, Guwahati. This is an open clinical trial. So I would like to put a glimpse regarding the therapeutic study. The selection trial drugs was named to be as Bronco T plus. A series Kanthakari, Justimodu, Vasak, Tulsi were taken in 2 gram each, a total of 10 gram. So this is the dose and preparation. Firstly, this was in the form of coarse powder. Sir, next step. No, sir, next step. Sir. No, sir, next step. Next step. Next, sir. Next slide, sir. Next slide, sir. Next slide, sir. Sir. Yes, yes, sir. Upper one, sir. Upper one, sir. Upper one, sir. Sir, this down, sir. Okay, sir. Next slide, sir. Sir. Dose and duration, sir. This was in preparing the coarse powder form of 10 gram each. They were preparing quart preparation, 160 ml, until it comes to 40 ml, and it's being used twice a day. So this is the result, the therapeutic effect on sign and symptoms, where when for a female dyspnea cough, which prolonged expiration, tightness of chest, palpitation, coragia, insomnia, headache. This was found to be very encouraging with 34, 86, 87%. Sir, next step.
आप थोड़ा जोर से
sir.
otherwise I am
हाँ,
able
sir.
to hear and listen. I am unable
sir.
to understand here.
हाँ sir.
थोड़ा जोर से बोलिए.
हाँ sir. Subjective and objective statistical assessment. Sir, here we have found that the Tamak Anupasana with 26.0227 T value, sir. T value were very highly significant in Kasa, Gurgur Dhwani, Pratiloma Bayu, and Parsa Avagraha. This proved that this drug have an potent effect on this clinical sign and symptoms. Also, we did our objective assessment like peak expiratory flow rate, absolute eosinophil count, and ESR, where the statistical data T value were found highly significant, sir. No adverse effect or side effect was observed in any of the patients in the entire clinical study, sir. Sir, here, next, sir. Next, sir. Next. Hello. Sir. Next, sir. Discussion of the clinical study. Through this, we can conclude that Broncho T is found to be effective in the management of stomach sores, bronchial asthma. Now, sir, next molecular docking study, sir. Sir, next slide, sir. Molecular docking study, where we did study regarding Adatoda basica, Kanthakari, Solanum, Gentocarpum, Justimodu, Glycorogia glabra. First, to understand it, this topic, we are to understand the topic molecular docking study, and this is a computerized approach interdisciplinary subject of bioinformatics to solve the biological problem in life science. And this approach helped in drug discovery to develop fast and accurate target identification and predictions. Sir, next slide, sir. Firstly, what we did is I want to say regarding the aim and objective, sir. On the next slide, sir. Sir. This is the aim. Firstly, we identified the phytochemicals, Kanthakari, Justimodu, and Vasak. Then we identified a target protein, interleukin 3, interleukin 4, 5, 13, tumor necrosing factor, and eotaxin. Then the molecular docking analysis of the screen ligands of Solanum zentocarpum, Glycorrhizia glabra, Adatoda basica against the target protein, 3, 4, 5, 13, tumor necrosing, and eotaxin of asthma. So these were done and evaluate based on the minimal binding affinity. Sir, next slide, sir. Firstly, next slide, sir. Identification. We did identify the herbs, Kanthakari Justimodu, that is mentioned in our clinical, in our classical texts, and as well as in the scientific findings. Same like other Basaka also, we did study details regarding the classical texts reference as well as the modern scientific findings. Here is the identification of target protein or asthma, and this is a pathway through which we can identify the the pathway that is responsible for augmenting asthma, and this is a scientific server where we studied regarding the pathway of asthma. We have found that in the very initial stage. Sir, next slide, sir. Sir, please, the next slide. Sir, actually, it's next slide, sir.
Identification of Vasak. Next.
Sir. Yes, sir. Yes, sir. Sir, next, sir. Next, sir. Next slide, sir. Sir, sir. This one, sir. Sir. Yes, sir. Yes, sir. Yes, sir.
Which slide? Please guide me.
Sir. Previous slide, sir. Previous slide, sir. Yeah, previous slide. Back, sir. Back.
Be fast. Be fast.
Yes. Sir. This is the target protein. How we did analyze interleukin 3, 4, 5, 13, tumor necrosing factor, eotaxin. In the late phase, we have found that airway hyperresponsiveness, obstruction, inflammation, and further leading to fibrosis. And this was the main target. So these are the sir, next slide, sir. The materials and database and the software that were used are mentioned here. Sir, next slide, sir, please, sir. Yes, sir. This next slide, sir. Sir. Sir, please, the next slide. Sir, this one, sir. This is the molecular docking workflow set, sir. Target protein, where we select the target protein from the KEGG. Then we prepare the protein. Same like we select the ligand, we prepare the protein, then we allow to dock, then we evaluate the molecular docking result. So these are the, sir, next slide, sir. Hello, sir, next slide, sir. Sir, these are the proteins that were being retrieved from RCBS and selected for the study. Then next, sir, these were the 8 phytochemicals of Kanthakari. This is the 119 phytochemicals of Justimodu. Sir, next slide, sir. Next slide, sir. Sir, please continue, sir. Yes, sir. This one, sir. These are the 12 phytochemicals of Adatoda basica. And this is the toxic assessment of 119 phytochemicals where we did study about the hepatotoxicity, carcinogenicity, mutagenicity, cytotoxicity, molecular weight, and the lipid skins violations, then GI absorbability. Sir, next, sir. Sir, please proceed, sir. Yes, sir. This one, sir. Yes. Sir, the 12, sir. Actually, sir, it's too fast, sir. Okay, sir. It's being we did the docking study. Then to conclude, sir, we found that hibiscus Hispa glabra binds with interleukin 3 and 4 with delta minus 8.2. This shows that Hispa glabra can be considered to be a potent drug candidate for asthma. Sir, next slide, sir. And in regard to the Adatoda, in the next slide, we have, sir, the next slide, sir. Yes, sir. Molecular docking result and conclusion of Adatoda basica, we have found that vesicinolone to be most potent that binds with interleukin 5 at minus 7.7 kilocalories Sir, the last slide, sir. Summary and conclusion. I would like to conclude that through this study, amalgamation of Ayurveda with various modern scientific and modern medical science is highly required to get an outstanding discovery and remedies having less side effect and toxicity for the betterment of mankind, sir. Sir, the next last slide, sir. Sir, next, sir. Sir, next one. Yes, sir. Future prospect of the study, what we need today is the drug with similar mechanism but less side effect, new classes of drugs to treat asthma, and the new classes of drugs that modify the course of the disease, that relax the broncho-smooth muscles, and to prevent and treat inflammation. So actually, it's being very difficult for me because my place is very remote, and I think so there is also network problem, sir. So I'm so sorry, sir, for the inconvenience, sir.
नहीं
And
नहीं
sir, I
आपकी
would like to
एक्सीलेंट
thank
एक्सीलेंट दमदार रिसर्च है जी आप ग्रेट
sir.
आपने रिसर्च बड़ी अच्छी की है वो कम्युनिकेशन प्रॉब्लम नेट की वजह से हुआ लेकिन यू हैव रियली कम्युनिकेटेड वेल दो सम नेट प्रॉब्लम वाज देयर so I would
अच्छा,
like to
बहुत रिमोट
request now
प्लेस पर है डॉक्टर साहब,
जय हो I am proud of him I
बहुत
am
रिमोट
proud of
प्लेस
him
पर है.
Sir, it's near China border.
near
China border, sir.
नियर
जी
अरुणाचल प्रदेश.
Yes, sir. Arunachal
हाँ
Pradesh, sir. It's
विष्णु
very
आदरणीय शर्मा जी to comment
Thank you, Dr. Rigam Pegu, for excellent presentation. You have showed our herbs how it acts scientifically. So thank you very much for your excellent presentation. God bless you. God bless you. Okay. Namaste.
now I would like to request Dr. निशांत शुक्ला जी आप हमारी सुनने के चक्कर में मत रहिएगा आप बोलते रहिएगा आपके यहाँ कुछ गड़बड़ हो रही है आजकल डॉक्टर निशांत शुक्ला जी डॉक्टर निशांत शुक्ला जी
Rigam OPD কৰি আছা?
sir, curious, sir. It's been
কৰি
very
আছা.
kind, sir.
কোৱাৰ্টাৰ আছে নে? তোমালোকৰ কোৱাৰ্টাৰ আছে?
Yes, sir, but sir, what is not available to doctor, sir.
5 बार
কোৱাৰ্টাৰ
बुला
নাথাকা
चुका हूँ
নেকি?
हाँ सर.
5 बार बुलाया मैंने अभी आपको प्लीज ठीक कराइए काइंडली पहले बहुत अच्छा चलता था कुछ गड़बड़ हो गई है पहले नहीं जूम से कोई गड़बड़ नहीं है क्योंकि सब लोगों को सुनाई पड़ रहा है सब लोग बोल रहे हैं सब लोग कम्युनिकेट कर रहे हैं तो जूम से गड़बड़
हेलो नमस्कार. हेलो नमस्कार, क्या मेरी आवाज आ रही है?
आ रही प्लीज कंटिन्यू
हेलो, क्या मेरी आवाज आ रही है?
यस यस
हेलो,
आवाज आ
क्या
रही
मेरी आवाज आ रही है?
यस
हाँ, शुक्ला जी आपका आवाज आ रहे हैं.
आती नहीं है तो पूछते क्यों हो सर आपको हमारी तो आवाज आती नहीं है प्लीज कंटिन्यू आप टीवी आप वीडियो भी तो देख लिया करो हम क्या इशारे कर रहे हैं कंटिन्यू प्लीज कंटिन्यू आपकी आवाज आ रही है आपको हमारी नहीं आ रही
Care in Ayurveda. Today we are celebrating, or we are encouraging the people to take a proper care in asthma. How to prevent asthma, how to treat asthma, and how to manage the complication. Because asthma अगर continue रहा तो उसके कारण bronchiectasis, COPD, राइट वेंट्रिकुलर हाइपरट्रॉफी और CCF जैसे गंभीर प्रॉब्लम भी हो सकती हैं। तो हमें अस्थमा डे पर अस्थमा के पेशेंट्स को केवल अस्थमा में रिलीफ हो, डिस्पनिया में रिलीफ हो, उस पर फोकस नहीं करना है, पर उसके साथ साथ पेशेंट में होने वाले जो कॉम्प्लिकेशंस हैं तो हमें फोकस करना है। आज हम इस चीज पर बात करें, व्हाट इज अस्थमा। वर्ल्ड अस्थमा डे इज ऑब्जर्व्ड ऑन ट्यूसडे 6 मई 2025 विद द थीम मेक इनहेल ट्रीटमेंट एक्सेसिबल फॉर ऑल। आयुर्वेद में भी हमें जो है वो इस प्रकार से इनहेलर्स को डिजाइन करना पड़ेगा कि जिससे हम पेशेंट को लाभ पहुंचा सके। Importance of ensuring that people diagnosed with asthma have access to inhaled medications which are necessary both for controlling the disease and treating the. Hello. What are the prevalence of asthma? What is the prevalence of asthma is in developed. There is high medical major medical illness प्रॉब्लम इन द वेस्टर्न वर्ल्ड। आप हम देख सकते हैं इस ग्राफ में कि यहाँ पर हम देखेंगे कि जो यूएस वाला जो एरिया
निशान
है
जी,
यहाँ पर
आपका वॉइस
काफी
नहीं आ
प्रॉब्लम
रहा
है। उसी प्रकार से यूरोप के एरिया में यूके में ये प्रॉब्लम ज्यादा सीवियर है, उससे थोड़ी कम जो है ये प्रॉब्लम कनाडा वाले इलाके में है। यूएसएसआर में मेजर पार्ट ऑफ द यूरोप एंड मेजर पार्ट ऑफ साउथ अमेरिका, यहाँ पर जो है ये प्रॉब्लम काफी हद तक देखी जा रही है। There is high prevalence observed in the developed countries। तो यहाँ पर हम देख सकते हैं कि डेवलप्ड कंट्रीज में ये प्रॉब्लम ज्यादा सीवियर है।
He is rejoining at present. His connection is somewhat disturbed. मैं फिर आप जुड़िए, तब तक फिर मैं सुपर्णा जी को बुला। I would like to invite Dr. Suparna Sanyal Mukherjee Madam for her blessing to the platform. Dr. Suparna Sanyal Mukherjee ji, and then from Yoga Sanatan ji. Dr. Suparna Sanyal Mukherjee Madam. Am I audible? Welcome, madam. Welcome.
Regrets and gratitude to the AYUSH Samriddhi once again. So today's topic is very important and it is a really burning topic today because the way the air pollution is going on, so most of the people are suffering from asthma. So bronchial asthma is a well-known hypersensitive. Say we cannot cause it's a disease. Like a, everyday symptom which is happening in each and every parts of the world, especially the where the population density is high, where the motor vehicles are high, where the civilization, the city orientation is very high, which prevalence is being rapid